simple or more complex cosmetic procedures, mostly you're thinking of women. You think it's normal that women are talking about Botox, about fillers, about contouring. But on the other hand, there are more and more men considering cosmetic treatments, even in the more conservative places such as the UAE or the GCC. And even the acceptance of talking about it is becoming more and more. So today we have Dr. Nadeem Akhtar. He's consultant of plastic reconstructive and aesthetic surgery at Zahra Hotel in, Zahra Hospital in Sharjah. And he will be talking to us about the newest techniques and possibilities and what the acceptance is like with men and women. So can you tell us the most common procedures that people are demanding in cosmetic surgery or treatments?
To be fair, yeah. I think the most data comes from the American Association of Plastic Surgeons. And what they've revealed, I think the trends are actually quite similar to the UAE. What we do know is that there's been a significant rise year on year, particularly with men. If you go back 20 years, I think it's about 340% rise in cosmetic practice. Now in women, the most common things, and the Americans have done quite a good job, they have divided it into surgical procedures and the minimal invasive procedures. So for women, the surgical procedures, by and large, the most common is breast augmentation, followed by liposuction, rhinoplasty, and eyelid surgery. And for men, what we found there is rhinoplasty is the most common, followed by eyelid surgery, gynecomastia. When you're looking at the non-invasive things, for both, I mean, women especially, 6.6 million Botox injections a year, and for men, again, it's Botox. And what's surprising is that for men and women, the top 5 in the minimally invasive procedures is actually the same, although where they rank, other than the Botox, is different. So again, you have fillers, you have chemical peels, microdermabrasion, and the incidence, by and large, other than the microdermabrasion, is all increasing year on year. When I look in my own practice here, I see women coming for Botox and fillers, as you'd expect. Haven't yet had any men come for that, but for men, what we see is they're coming, they're becoming more concerned about their appearance. People are going to the gym, having lost weight. They're concerned about having male breast, gynecomastia. They've come to have that looked at. They want a more trimmer figure, so they're considering cryolipolysis, liposuction, tummy tucks. And when I speak to colleagues working in more busier units, that's exactly the same thing. So the trends are quite similar to the US, with the exception, I think, hair transplant is more requested here in the UAE than it is in the US.
But would you say that that you see more of the surgeries increasing and not so much the Botox among men?
Well, I think it's all increasing. Again, if you look at the States, Botox is way out there. And the one thing about Botox, and that's what the Americans have found, is because it's minimally invasive, you can come in, you can have something done. And people nowadays, or often, especially men, don't want